Blood tests, usually just, another doctor's visit, right? Quick stick, then you wait. But what if they were more? Like a crystal ball, maybe? Not just for your health right now, but showing your whole health journey. That's kind of what we're digging into today, going beyond just the basics.
Exactly. We're talking about shifting away from that reactive fix it when it breaks idea, moving towards something much more proactive, sustained wellness. It's really about understanding the story, the narrative your blood tells over time.
Okay, so let's unpack that. How these health snapshots, how a series of them can build up to show a real trend line for your health, giving you knowledge you can actually act on.
Yeah, this is where it gets really interesting for me. Think about a single high blood glucose reading. Could just be that big lunch you had, right?
Yeah.
Or maybe a stressful day. Absolutely. But what if we look at those numbers over, say, a few years? That's the difference between a single snapshot and what we call longitudinal trend analysis. It's powerful. So a consistent increase in blood glucose, and especially that HbA1c level, that can clearly point towards diabetes, often way before you even feel any symptoms.
HbA1c, that's the one that gives the average over a few months.
That's right, 2 to 3 months average blood sugar. And if that HbA1c is consistently hanging out between 5.7% and 6.4%, that signals pre-diabetes. It's a critical window to make changes. Seeing that trend really empowers you, doesn't it?
It really does. So for you, the listener, this trend line idea, it means early detection, prevention, like monitoring chronic conditions. People on blood thinners, warfarin, for example, they need those regular PTT and INR tests. It's not just a checkup. It's vital monitoring, right? Keeping things in the safe zone.
Precisely. It's ongoing management based on the trend.
Okay, so we all hear about common tests, CBC, lipid panel, sounds routine, but you're saying there are details within those tests that reveal, well, maybe surprising things.
Definitely. Let's take the complete blood count, the CBC. Okay, low red blood cells, anemia. But what kind of anemia? That's where other numbers come in, like the MCV and RDW, the corpuscular volume and red cell distribution width. If your MCV is low, but the RDW is high, that might suggest iron deficiency. But if the MCV is low and the RDW is normal, totally different picture. It could be something like thalassemia, a genetic thing.
Wow. Okay, so tiny details, huge difference in what might be going on. What about metabolic panels? The CMP.
Right, the comprehensive metabolic panel. It checks kidneys, electrolytes, sure, but also liver function. And the connections are key. For instance, high ammonia levels. That can point to issues in both the liver and the kidneys. Shows how interconnected everything is. And for the lipid panel, we know LDL, HDL, bad and good cholesterol. But looking deeper at things like the triglyceride to HDL ratio, that can actually be a better predictor of cardiovascular risk for some people.
Okay, that's a lot to think about just in the standard tests. It feels like we're moving beyond just normal ranges here.
That's a really important point. There's this growing conversation about normal versus optimal. Conventional medicine often uses broad, population-based normal ranges. Fine. But a more precision approach looks at narrower optimal ranges for you. So your glucose might be technically normal, but if it's always at the high end of normal, that could be an early sign of developing insulin resistance, long before it's full-blown diabetes.
Catching those subtle things before they become a diagnosed disease, that's powerful. So looking ahead then, what's on the horizon? What's next for blood testing?
Oh, the future's pretty exciting. We're seeing development of liquid biopsies. These are blood tests designed for early detection of cancers that are hard to screen for, like ovarian or pancreatic cancer, catching them much earlier. And also tests looking for early signs of Alzheimer's disease, measuring specific substances in the blood from injured brain cells.
Really trying to get ahead of these major diseases. That's incredible. Okay, let's bring it back to practical steps for you listening. Preparation is key, right? Like fasting.
Absolutely. For many common tests, glucose, cholesterol, triglycerides, you need to fast, usually 8 to 12 hours, just water. Food can really skew those results, give you a false reading, so follow those instructions.
Good reminder. And when you get that report back?
First thing, an abnormal result isn't automatically a diagnosis. It's a signal. It just means your doctor needs to investigate further, look at your whole picture, history, lifestyle, everything. And try to use the same lab consistently if you can. Reference ranges can actually differ a bit between labs.
Consistency helps track that trend line accurately. Makes sense. And how often should people get tested? Is once a year enough?
It's really personalized. An annual checkup is a good baseline for many healthy adults. But if you have risk factors, family history, or you're managing a condition, then more frequent testing, maybe twice a year or even more often as your doctor advises, is essential. It helps monitor how things are progressing against your baseline.
This has been a fantastic deep dive. Really changes how you think about blood tests. They're clearly so much more than just numbers. They're, well, a vital conversation starter about your own health.
Couldn't agree more. Regular blood testing, when you see it as part of that ongoing talk with your healthcare provider, it's an incredibly powerful tool. It really gets back to that core idea. Prevention is always better than cure.
So the next time you think about getting a blood test, remember what we talked about. You're not just getting a snapshot. You're actually mapping your health journey. You're taking an active role. Makes you wonder, doesn't it? What will your trend line look like?